Welcome to today's Spark Your Health talk, The Power of Lifestyle Medicine for Breast Cancer Risk Reduction and Recovery. My name is Katira Noviello-Kapoor, and I am the Senior Director of Health Promotion, Wellness, and Athletics at the 92nd Street Y. This evening, we look forward to delving into the hows and whys of utilizing the lifestyle as medicine approach to support breast cancer prevention and recovery, featuring Dr. Amy Comander and Dr. Michelle Tollefson, in conversation with Yonni Wattenmaker, Executive Director of Breast Cancer Alliance. I would also like to thank our Spark Your Health Talk series sponsor, Mount Sinai, for their support. We hope you will be able to join us for upcoming Spark Your Health events this winter, such as Keys, Bags, Names, Words, Hope in Aging and Dementia. This is a virtual documentary screening and panel discussion event in collaboration with the Program for Cognitive Strength and Ability coming up next week on March 5th. We will leave 15 minutes at the end of our program for questions, which will be collected from the chat. So please feel free throughout the duration of the event to be typing in your questions. I am now pleased to introduce our moderator this evening, Yonni Wattenmaker. Yonni has been serving as Executive Director of Breast Cancer Alliance since 2011, a local charity upon her arrival, and now one of the highest ranked and most prominent breast cancer charities in the United States. She has been named one of 40 Fascinating Women by WAG magazine and is a Woman Who Inspires in 2021. Yonni is also a certified health coach and founder of Yon Appetit, offering healthy recipes, tips, and personalized nutritional coaching. Welcome, Yonni. Thank you for being with us this evening.
Thank you. It's such a pleasure to be here. I really appreciate the opportunity and look forward to the panel. So, let me get started with my own introductions of our wonderful two panelists. First is Dr. Amy Comander. Amy is a breast oncologist at Massachusetts General Hospital Cancer Center. She also holds the role of medical director at Mass General Cancer Center. And Dr. Comander is a director of lifestyle medicine at Mass General as well, the first ever dedicated lifestyle medicine program in an academic cancer center. Dr. Comander is an instructor of medicine at Harvard Medical School and is co-founder of Paving the Path to Wellness, a 12-week lifestyle medicine-based survivorship program for women with breast cancer. Dr. Michelle Tollefson is board certified in lifestyle medicine, as well as obstetrics and gynecology. She is a professor in the Health Professions Department at Metropolitan State University of Denver, where she created and oversees the lifestyle medicine program. She is on the executive board of the nonprofit organization Paving the Path to Wellness. Dr. Tollefson is editor-in-chief of the textbook Improving Women's Health Across the Lifespan and co-author of Paving a Woman's Path Through Menopause and Beyond, as well as the Paving Workbook. So thank you both so much for being here today. And I'd like to start the conversation talking about risk reduction in breast cancer. There are both genetic risk factors, which are risks over which we have no control, and then epigenetic or modifiable risk factors, which we do have better control over. And I'm wondering if you can speak to genetic risk to start, and what our audience should know about determination of risk.
Thank you so much for that great introduction. Michelle and I are so excited to be here tonight to join you to discuss this really important topic. Well, you started off by asking a really important question. How much of breast cancer risk is due to genetics? That means genes that can be tested for with either a saliva sample or a blood sample. And we know that the American Cancer Society recently released statistics predicting that there'll be close to 300,000 new cases of breast cancer diagnosed in the United States this year. We do know that approximately 5 to 10% of these breast cancers are due to genetic mutations that we can currently test for in 2024. So that's really a very small fraction of the breast cancers out there that are truly due to genes that we can currently test for, such as BRCA1 and BRCA2 and many others. I should note that there are many families where there does appear to be a strong family history of breast cancer, and maybe a gene just can't be identified. And that accounts for about 15 to 20% of breast cancers diagnosed in the United States.
So then, of course, that leaves so many with a question of why are they being diagnosed? What are the risk factors? Does living in certain places amplify your risk? What are some aspects that you can speak to, whether it's about diet or lifestyle and so forth?
such an important question, and that's something that comes up in my clinic every day. Why did I get this diagnosis? And many times we don't really know why an individual is diagnosed with breast cancer, as we'll discuss over the course of this session. But I think it's helpful to think about, as you already alluded to, what are some of the non-modifiable risk factors for breast cancer, and what are some of the factors that can be modified that we do have some power over. And so let's just start with the non-modifiable risk factors. So the first one that comes to mind is being a woman. We know that's a risk factor for breast cancer. And getting older. We all want to celebrate that next birthday, but age is a risk factor for breast cancer. Other risk factors include genetics, which we just talked about, having a family history of breast cancer, having a previous breast cancer diagnosis is a risk factor, having a breast biopsy that maybe shows some atypical findings, whether that's atypical hyperplasia or something called lobular carcinoma in situ. Those pathologic findings are risk factors. We also have to take into account race and ethnicity, breast density, hormonal factors such as age of menarche, late menopause, other hormonal exposures, and then prior chest wall irradiation before age 40, which in my field as an oncologist used to be used to treat some types of lymphomas, but of course we're trying to get away from that now. So those are the non-modifiable risk factors. And then we think about the risk factors that we can modify, which of course is where lifestyle medicine can play a role. So we think about, addressing obesity, physical activity, alcohol use. And then we think about, did a woman have an opportunity to breastfeed? And then of course, thinking about hormonal factors such as use of oral contraceptive pills, hormone replacement therapy after menopause, et cetera. So those are two ways to think about the risk factors.
Thank you. So Michelle, is there anything that you would like to add to that, or one or two risk factors that you think are places for women to start when considering what they might want to do to reduce risk?
So thank you again for the opportunity to join you this evening. So yes, my favorite one to suggest that women start working on is physical activity if they aren't already doing it. So in addition to decreasing the risk for pre- and postmenopausal breast cancer, we also know that physical activity helps with many different mental and physical health concerns. So I think most women know that physical activity decreases the risk of type 2 diabetes and cardiovascular disease and stroke risk reduction. But I think many women don't fully understand the power of physical activity to really help with brain health. So when we are physically active, it helps improve our mood and concentration, our alertness, our creativity. Also, when we exercise, we produce what's called brain-derived neurotrophic factor, or BDNF, which John Rady has called miracle grow for the brain. So the BDNF supports creation of new brain cells and synapses, improves cognition. We also know that we know that physical activity helps with sleep, increases energy, helps with our functional ability. So when we think of what we want to be doing when we're 80 years old, I want to be traveling, I want to be playing with my grandkids, I want to be active. And so physical activity can help me be able to get there. So physical activity is my favorite one to chat with patients about.
So I've heard differing opinions about how much physical activity is recommended. So some people have said 120 120 minutes a week. Other people say 150, a mix of cardio and bone density training, like strength training. Do you have a recommendation about what you think it should be?
Yeah, so the guidelines suggest at least 150 minutes of at least moderate intensity activity a week. And that can be spread out throughout the week. So like 30 minutes, 5 times a week. We used to think that exercise had to be done in at least chunks of 10 minutes, but now we've really learned that every minute counts. You can do a few minutes here, a few minutes there. Also, I think sometimes we get so caught up in the I need 150 minutes that we don't stop to just say, what can I do? What am I doing now? And is there any way that I can move more or sit less? So sometimes I think we let the enemy of, am I going to meet the 150 minutes? Am I going to meet that goal? And so even though that's a great goal to keep in mind, I just encourage women to start wherever they're at and see if they can move more and sit less.
I think that's great. And I think also someone had this great line of what's your favorite exercise, or what's the best exercise? And it's the one you're willing to do. So hiking, running, biking, going to the gym, weightlifting, it's different for everybody, but just the fact that you get it in is certainly beneficial. So thank you for helping to clarify that as well. More and more what I've been hearing about, in addition to occurrence being on the rise, even though thankfully survivorship is also on the rise, is that women under 40 seem to be more frequently diagnosed. And I was wondering if you could speak to whether that's because of early detection and women are smarter about getting to the doctors. And that's why we're seeing more in younger women, or if there's something else that you can point to. And I guess piggybacking on that, since most mammography, you can't begin until 40 unless you have, a risk factor. What do you recommend women under 40 do?
That's such an important question. And certainly we're doing more and more research to understand why are we seeing this increase in breast cancer diagnoses in women under age 40. And really, this is an observation. This has been published. There was a publication last summer in JAMA Network really focusing on this increasing incidence, particularly from 2010 into 2019, seeing this rising incidence of young onset breast cancer. And I think we're still trying to figure out the reasons for this. We've already alluded to many of the risk factors. Could it be due to lifestyle factors? We know, by the way, interestingly, that obesity is a risk factor for postmenopausal breast cancer. Not premenopausal breast cancer, but is it other lifestyle factors that could be playing a role here? Increased sedentary behavior, changes in nutrition, changes in the gut microbiome. Is it also due to changes in fertility? We know that women are delaying childbearing till older ages. So there's so many factors that need to be explored to help us truly understand this. But you do ask such an important question, like how do we figure out should younger women get screened or not? And interestingly, the American College of Radiology did come out with a recommendation to state that starting at age 25, a woman should undergo a risk assessment to determine at what age she should start screening. And that is a great recommendation. Of course, we want to pick up cancers in younger women as soon as we can, but what is the best screening tool? What is the best risk assessment tool? These are questions that in my field, we're really trying to answer.
Thank you. And Michelle, maybe you can answer this, but if you've had breast cancer in an immediate family member, when do you recommend you begin in comparison to the age that they were diagnosed?
Yeah, I'll let Dr. Comander take this one.
Okay,
since she's the breast
sorry.
oncologist. No, that's fine. Go ahead.
No, it's great. But I mean, I would say great question. First of all, we now know that genetic testing really should be done much more widely than we had done in the past. So if I'm seeing a young woman for we call it a high risk consultation to determine when should she start screening, et cetera. If she has a first degree relative with breast cancer, first of all, I ask, did that individual have genetic testing? It's always best to test the affected person first. But if that's not possible for various reasons, then we might consider genetic testing for the patient who's seeing me to just see, does she have, a mutation that can confer an increased risk for breast cancer. But another rule we tend to think of, let's say she doesn't want to do the testing and someone was diagnosed at age 45, maybe we'd say we really should start screening 10 years earlier than that individual's diagnosis. So these conversations are very challenging and difficult, but I'm glad, when a patient's in the room and wants to talk about that, and she's being proactive, I think that's a really good sign.
Thank you. So, we talk a lot about mammogram. And we, as we just said, we talked about now the guidelines suggest that you start at 40 unless you do know of a risk of some factor. But mammogram is not foolproof. Mistakes can be made. Different radiologists pick up on different things. There are different types of mammogram, whether it's 3D or 2D, but there are other modalities as well. So can you let people know a little bit about what other screening options are and maybe when you should be looking to employ one of those other options?
Such an important question when we think about screening. And first of all, we should just be grateful that we have all these screening tools at our disposal and that we can take advantage of these to pick up cancers when they're smaller at an earlier stage and therefore more curable. So mammogram is the technology that you've mentioned that we're all familiar with, and certainly a very effective screening tool, our most effective screening tool to pick up breast cancers. But some individuals who may be at higher risk, we talked about those with a genetic mutation, strong family history, that's when breast MRI may be considered as well, particularly in younger women. We know that younger women have very dense breast tissue, and therefore a breast MRI is a better screening tool in that setting. So breast MRI can often be used in addition to mammography for a more effective screening program. Some centers also use breast ultrasound. I would say not every center does that, but that's something that may be offered at some centers, particularly for women with dense breast tissue. And then, as you noted, there are more technologies out there to look for better approaches for screening, whether that's mammography with contrast and other technologies that are more cutting edge that we'll look forward to learning about hopefully in the next few years.
Thank you. And just to go back to something that you mentioned, you talked about women at 25 and above should ask for a risk assessment. Would they ask their primary care physician or their gynecologist? Who would they make that request of?
Great question. I think most women that age in their 20s often are seeing their gynecologist. And so I think, look at Michelle, who I know is a gynecologist, like this is something that often now is being practiced. But I do think it's an important question. What is the best screening tool to assess risk? We do have lots of models out there that I don't need to get into here, but some of them have a lot of flaws. And I think there's a lot of interest in using tools such as artificial intelligence and other tools to find better, more appropriate screening tools to assess risk. So I think this is an evolving area for sure.
Thank you. Now, Michelle, I know you have some personal experience here to share. So I was wondering if you would be willing to share a little bit about your personal story.
I'd be happy to. Thank you for asking. So being an obstetrician gynecologist, I did many, many clinical breast exams and had found breast cancer in some of my patients over the years. And then at age 40, I had my first mammogram, 41, another screening mammogram. And so I got the reminder to schedule my mammogram when I was 42. And I made that appointment just 1 year and 1 week after a completely normal 3D mammogram. I could feel no lumps. I had no symptoms. I had breastfed my 3 kids. And so I was not worried at all about the screening mammogram. So I did the mammogram. And then later that day, I got the call that nobody wants to get that one that said there's something suspicious on your mammogram. And I was in a coffee shop and pulled up my images and saw what changed my life forever. So I had an aggressive breast cancer. I had a bilateral mastectomy and went through 16 rounds of chemotherapy. And while going through that, I was really fortunate to be able to use lifestyle as medicine in conjunction with all that conventional medicine had to offer. And so I was able to work with a physical therapist who helped me stay moving and doing some physical activity every day during chemo, which I think really helped my energy. I was able to meet with a dietitian who helped me eat nourishing foods, met with somebody with expertise in sleep. So I really felt fortunate to have such amazing resources. What I was surprised about is when I finished chemotherapy, I was grateful, but I also felt like, what now? Like I was, where do I go from here? I definitely felt like I was a survivor, but I wanted more. And so I joined a survivorship group which turned out to be a very depressing group. I went once and just felt like it wasn't for me. It wasn't for me. So I was talking to my dear friend and mentor and colleague, Dr. Beth Brady's, who created the Paving the Path to Wellness program that day. And I told her, I am not going back to that survivorship group. I am done with it. I went once. I can look at the literature myself. And she said, I want to connect you with Dr. Amy Comander, who had just switched to a virtual Paving the Path to Wellness group because the pandemic had just started. And so I thought, I do not want to join another survivorship group, but I would do anything that Beth Brady's recommended. And so I joined Amy's group, and I thought, I already know all the lifestyle medicine things about nutrition and movement, but it was really that this program focused also, in addition to nutrition for breast cancer survivors and physical activity, which is so important, it also talked about purpose and about attitude. And I was kind of like, I got breast cancer and I thought I was already healthy. So now I'm just going to push myself harder. I'll exercise harder and I'll eat healthier. And I'm just going to really double down. But it was like, what kind of attitude do I want to live with? I don't want to just be punishing myself with exercise. I want to have joyful movement and enjoy nourishing food. So variety, investigations, goal setting, all these different things. I just had a wonderful wonderful experience with joining these women virtually who are in Boston. And at the end of it, I just felt so grateful to go through a program like that. And that's why we've stayed connected, and I've tried to help support the work that Amy and Beth have done with the Paving the Path to Wellness program.
Thank you so much for sharing. And I think there's something else that I think we're going to come back to in a minute, but there's also a level of guilt that women who are diagnosed with breast cancer seem to have more than other patients who are diagnosed with cancers, as if they did something to deserve it, like they made a mistake and they caused it, because there's so many questions about, if it's not familial, where does it come from? So just that sense that you said about living with joy, remembering how to do that, forgiving yourself, lessening stressors, I think is so important. We have a couple of questions that have come in. I know Amy, go ahead. Sorry.
First of all, can I just say one quick thing, Michelle?
Yes.
I'm so grateful to you and for sharing your story so personally. And I mean, that's what's actually brought us together. So just acknowledging that. And then another thing you said, Yonni, women feeling guilty that they did something. I'm going to quote something also that our colleague, Dr. Beth Brady's always says, and I actually love this line: no shame, blame, or guilt. Okay. And when it comes to cancer, as we've discussed, there are so many complicated factors that can contribute to an individual's risk of why she got breast cancer. I see marathon runners who are vegan who still get breast cancer. We all have a 1 in 8 lifetime risk in this country. So I just want to acknowledge what you said. And I don't want anyone to ever feel guilty that they have to come to my office and see me. And I know, Michelle, you agree with me 100%. So
thank you so much. And thank you for pointing out the risk. I know it's an overwhelming number, but it's important for people to understand. So, one of the things that we didn't touch on, but just to talk about briefly, and then we'll move on, is AI and the role of AI and the development of new technologies for funding, for finding lumps and things. I know that Breast Cancer Alliance, many years ago, we spoke about this last week. We supported a researcher up in Boston, actually. This is not an intentionally Boston-focused discussion, but it happens. Looking at AI and how it might have helped her to detect her breast cancer sooner than it was found. So I think it's also just important for people to understand that there are constantly new technologies that are being explored to try to make these, better science and more successful in terms of finding the disease and finding it earlier. So, but let's talk a little bit about treatment. So there are drugs like tamoxifen, for example, that are used in treatment. And again, Amy, you can certainly speak to this, but tamoxifen is also something that you can use as a form of prevention. And I was wondering I know this is a very elusive subject, but if you could speak one on the treatment side, but then also a little bit about prevention and the challenges that lie there.
Great question. So tamoxifen is a very powerful drug. In my world, I like to say it's the first targeted therapy in oncology. We have lots of fancy drugs out there, but tamoxifen is my BFF. So I will say that, tamoxifen is a really important drug for treatment of breast cancer, particularly in pre and perimenopausal women. It's like blocking the estrogen receptor in breast tissue or in any breast cancer cells. And actually, it's acting more like estrogen on our bones. So it helps our bones stay strong. So it's used to treat breast cancer in many settings, as you noted, but also it can be used to help reduce risk of breast cancer in individuals at high risk. So we talked earlier about doing a risk assessment on a patient to try to determine what is her risk of developing a future breast cancer, perhaps based on her family history, whether she had a biopsy that showed some atypical findings or other factors. So that patient could consider taking a medication such as tamoxifen, and there's some others too, but tamoxifen is probably the one we talk about the most, to help lower risk. And these are obviously complicated conversations because these are medications that obviously have side effects. And so if an individual is choosing to take this to help lower her risk of breast cancer, sort of the risk benefit analysis, like how much does she want to tolerate in terms of side effects to help lower the risk? But these are pretty powerful in terms of lowering risk. So I definitely think for individuals who are high risk, it's definitely worth a conversation.
Thank you. Michelle, maybe this is a question for you. There are lots of myths once you're in recovery about foods you should avoid, like soy products, or getting enough sleep, even though your hormones are out of whack. I think anyone who's going through menopause on this in this conversation can relate to that. And fatigue, challenges with overcoming that. So maybe you can speak to just some guidelines about dispelling some myths, and also maybe techniques you have for, like you said, finding joy or feeling less stressed or getting more sleep.
Sure, I'd be happy to. So soy is a fun topic to discuss because there is such a myth surrounding it that women who have had breast cancer or maybe at an increased risk for breast cancer should not eat soy foods. But the American Institute for Cancer Research, after evaluating quite a lot of research, has found that there's no increased risk for breast cancer survivors who consume soy foods. And there may be even there's limited evidence showing that there might be some potential for greater overall survival and perhaps decreased recurrence for women who are eating a moderate amount of soy. So like 1 to 2 servings a day of whole soy food. So we're talking about like tofu or soy milk or edamame and soy nuts. That doesn't mean we recommend soy isolates and supplements. It's really those soy foods that have been found to be safe and potentially beneficial. Sometimes they can help some women with hot flashes and night sweats, which is great. But eating a diet that's high in a lot of whole foods, a lot of plants, has been found to help women with some of those hot flashes as well. So there's all different fun ways to include soy in your diet. So I encourage your listeners to try experimenting with soy if they don't already eat soy and if they don't have a soy allergy. It's a great way to get in some good protein and a great source of phytonutrients.
I know that.
Go ahead.
I'm sorry, go ahead.
I was going to touch on sleep, but Amy, is there anything else about soy or that you wanted to add?
No, I think you covered it beautifully. I think it's just also a great example of a plant-based protein, and maybe we'll get more into this, but many of our patients are looking for options how to incorporate more protein into their diet if they're following more of a plant-forward type of diet. Mm-hmm. And soy is a great protein source, edamame, tofu, all the things you mentioned, Michelle.
That's great. One easy tip that I love from the American Institute for Cancer Research is they recommend that we get about 30 grams a day of fiber. And in the United States, we are very fiber deficient. The baseline recommendation is that we get 25 grams of fiber, but only most women in the United States get about 12 grams of fiber. And so that's fiber is found in plant foods, so fruits and vegetables and whole grains and nuts and beans and seeds. And so I think getting women to think about how much fiber they're taking in a day is also a great tip in order to help them decrease their risk and then just improve overall health and well-being.
What about vitamin D? I hear a lot about vitamin D. Is that something I think most women are deficient unless they live in very sunny places all year round where you can get it naturally outside. But vitamin D or magnesium, are there other supplements that people should be making sure they have enough of?
I'm happy to address that. So I will first of all just start off by saying, and maybe there'll be questions about this at the end, in general, supplements, the general heading of supplement should not be used to help reduce risk of cancer or reduce risk of cancer recurrence. I know that's not what you're asking. Vitamin D.
No, that's important though. Thank you.
Yes, but vitamin D, of course, is an exception. Look at me. I have very fair skin. I live in New England. I have not seen a ray of sun since last August. Okay. So I'm probably vitamin D deficient and I'm really bad about taking my vitamin D. But yes, with my own patients, I'm better. And certainly my patients are often on medications such as aromatase inhibitors or other medicines that may cause a decline in their bone health. And we're all about building strong bones. It's so important. And so vitamin D is a key component of that. So often I'm talking to my patients about how they can optimize the calcium intake in their diet, which is the best way to get the calcium. But vitamin D often does need to be obtained as a supplement because unless you live in the Caribbean or something. So that is a great question. And there are some studies that suggest that vitamin D intake can also help with arthralgia, secondary to aromatase inhibitors. So I think vitamin D is really important. So I'm glad that you asked about that.
Sure. So I think it's a good segue into hormone replacement therapy. it's a lot of women are, as you both are well aware, put into menopause as a result of their treatment. Other women are menopausal when they're diagnosed, and there is a lot of conversation about HRT therapy. Should they take it if they've had breast cancer? Should anybody take it if they haven't had breast cancer? Does it increase your risk? And so I think to help clear the air on what people going through menopause or approaching menopause should be thinking about when they're trying to deal with the effects of that transition would be really helpful.
I could start off, and Michelle, you're welcome to chime in because I know we talk about this a lot. So certainly, so let's first of all take a person who does not have a history of breast cancer. So she, doesn't have breast cancer, is wondering should she take HRT as she's going through menopause and perhaps having symptoms, hot flashes, etc. Certainly that individual would discuss with her doctor, whether it's her gynecologist or primary care physician, about the benefits of HRT and what the different options are, of which there are many. And I think do a risk benefit analysis, sort of like when we talked about, do you take tamoxifen for prevention, like sort of discussing the pros and cons and potential side effects. And she can make that decision if she wants to take it or not. For our patients who do have breast cancer, then it gets a lot more complicated. And I know this is a very hot topic these days, but certainly I think it's really important to think about what type of breast cancer does a woman have. I know in this talk thus far, we're using the term breast cancer, but we know breast cancer is not one disease. There are many subtypes of breast cancer. The majority of breast cancers are driven by estrogen. About 15% of breast cancers are not driven by estrogen. So there was a recent study that came out with some recommendations that perhaps women with an estrogen receptor negative breast cancer history could safely take hormone replacement therapy. For individuals who have an estrogen-driven cancer, I personally would still be very reluctant to recommend any type of systemic, or when I say systemic, like a pill form or a patch form of hormone replacement therapy. But that's different when we're thinking about vaginal estrogen. And Michelle, I don't know if you want to comment on the vaginal estrogen, why a woman might consider that, because certainly the sexual health concerns are very common in our patient population as well.
Course. So yes, so many of the women who go through either premature menopause with the breast cancer treatment or who are going through menopause, regardless of their breast cancer status, have what we call genitourinary syndrome of menopause, or GSM, which goes along with vaginal dryness, just dryness of the tissue, sometimes discomfort. And so in those women who are experiencing that, they often have discomfort with vaginal intercourse, sometimes even like riding a horse or doing something like that. So it's really important that women who are struggling with this, that they talk to their healthcare provider. So they're talking to their gynecologist, their primary care provider, their oncologist. We can use vaginal moisturizers on a regular basis that help with the vaginal tissue. We can also recommend vaginal lubricants to be used during vaginal intercourse, which can help to decrease discomfort. We also have there's a variety of different ways that we can try to help the vaginal tissue to stay as healthy as possible. If a woman is still struggling with that and they have tried those non-hormonal options, they may decide to try vaginal estrogen, but that really needs to be on a case-by-case basis after they discuss it with their oncologist and their gynecologist to kind of look at that risk-benefit profile. But sexual health is something that many women struggle with after treatment for breast cancer because of the changes in body image often, or if somebody had a surgery. We often see post-chemo or post-cancer fatigue. So any of those things that increase stress can decrease sexual desire, decrease libido. And then if somebody's having that vaginal dryness as well, it can make it really difficult. But the most important thing I like to tell women is don't wait. There is help. Seek help. Go talk to your healthcare provider. It's something where if we treat it earlier on, we can have better success with helping a woman maintain her sexual health and well-being.
I think it's so important, and even inviting the conversation and letting women know that they might not, they may think they're the only one who's dealing with that issue and be too ashamed to ask or think it's a frivolous question. And so I think it's so important to know there are resources out there and that this is more common than they might think, and they're not alone if they're having these changes. One of the things we haven't spoken about, we've spoken a lot about women, but actually my first exposure to breast cancer was as a little girl. My grandfather had breast cancer. He was diagnosed before I was born. He had a mastectomy on one pec, one lymph node removed. Unbeknownst to him, they gave my grandmother a prognosis for him of 4 to 6 months. And thankfully for all of us, he lived to be 97 and never had a recurrence, which is a wonderful story and what you hope for everybody who's diagnosed with this disease, of course. But for men, they don't get mammograms. And many of them don't understand that the genes can be passed from the male side, or that BRCA is something that can affect them, and certainly also relates to prostate cancer and other cancers. So what recommendations do you have for men in terms of being diligent, whether they know their risk or not, and what they should do if they suspect something?
So important that you brought that up. Men can get breast cancer too. I think that's a very important message that we can convey tonight. And first of all, I'm sorry about that story, but I'm glad he lived till 92. Amazing.
97, yeah.
Oh, 97. Oh my gosh. Okay.
Yes.
I misheard you, but that's even more amazing. So whenever I see a man diagnosed with breast cancer, by the way, genetic testing needs to be done. And we know that all men with a diagnosis of breast cancer have at least a 10% chance of carrying a BRCA1 or BRCA2 mutation. So that's very important. And then, of course, that has implications for family members as well. But let's say for men who may be watching this webinar tonight, I think it's just very important for men to be aware of their bodies. I think just knowing that men can get breast cancer is an important concept to convey. So, not all women do breast exams and not all men do either, but I think it's important to be aware of one's body, how things feel. So if there is a little lump or bump or nodule that, a man is aware that maybe I should go get this checked out. So you raise a really important issue.
Right. Or inverted nipples, right? I think are also an early sign for men and women. So,
correct.
Right. To notice those changes, pay attention and notice when something looks different.
Definitely.
Thank you. So we're moving soon into the audience questions, but we did touch upon stress. We talked about joy. But if you had to give a couple of thoughts about how you try to keep a positive space during recovery, are there modalities that you can employ? Are there mantras? Are there groups, Michelle, like you mentioned, where you really found connection? What are some pointers that you have?
So yeah, thank you. So for me personally, the Paving the Path to Wellness program really impacted my life in a way that I wasn't expecting. I was expecting to learn more about nutrition, and I did. I learned some new tips about nutrition and physical activity, and stress management and sleep and all of those things. But it was really those other areas, and being in a community of other women who were breast cancer survivors and who didn't just want to survive. These were women who had gone through this diagnosis and they wanted to thrive, and they were willing to put that work into it, to put the kind of self-care and to take the time to really look at what do I need to do as far as nourishing myself and how does that impact my health. Women who are saying, you know what, I don't know that I can do the 150 minutes a week of exercise, but I want to know more about joyful movement. I want to learn more about sleep hygiene and different things that I can do, tips and tricks. For me, I slept great prior to my diagnosis, but then after going through early menopause, I really struggled with that. And so, there's a lot of different scientific evidence-based tips that we can use in order to help with that. And then focusing on attitude. Once again, this is the program that Dr. Beth Brady's created, but talking about a growth mindset of everybody struggles and sometimes is not successful, but having a growth mindset and looking forward. The self-compassion, being gentle with ourselves. I know even though I know like 1 in 8 women will get breast cancer, I still did the why me and like, what did I do? So really having that self-compassion of, and I'm not going to eat perfect foods every day, and I'm not going to exercise perfectly every day, and that's okay. I want to live a joy-filled life. So I think just that attitude, the attitude focus. And then what was the most important for me was the discussion around purpose. I mean, I knew that purpose was important, but I think when you go through a cancer diagnosis or when you go through any major life change, I mean, it puts things in perspective and really it really made me think, what do I want to do with my time? Like what is most important for me? And I have 3 kids. And so spending time with my kids and my husband is incredibly important in my faith. And then also after going through paving, I thought I have to do whatever I can to help other women have access to this because, unfortunately, our insurance pays for all of these different chemotherapy and surgery, and I'm so thankful that it does. I'm so grateful that I had insurance and that I live in a country where I can have this. However, I felt so sad that other people didn't. Most women going through breast cancer treatment as survivors, they finish and they don't have access to a really positive, supportive group like this. And I think that that's an injustice. And I saw that injustice sitting in the waiting room, just thinking, this is an injustice that people don't know about the power of physical activity in order to decrease the risk of recurrence. People don't know about the possibility of a healthy, nourishing diet to decrease the chances of recurrence. Like obviously, it doesn't take it down to 0, but there are things that I can do. And when I felt really nervous about anxiety, about something coming up, I would just remind myself that there are certain things that I could control, but doing those different things, and the foods and the stress and the sleep and attitude, all those different things, they helped me feel better mentally and physically as a cancer survivor and thriver. But they also really helped with the menopause symptoms. And so that was the reason why we did the Paving Woman's Path Through Menopause and Beyond, is because I was going through the menopause symptoms and couldn't use hormone replacement therapy. And I thought there are not enough resources out there for women with evidence-based, from the literature, what are practical things they can do. And so Beth Frates and Amy and I wrote that book, and all the proceeds from our paving workbook and Paving Women's Path Through Menopause and Beyond, all the proceeds go to the nonprofit organization.
That's wonderful. Amy, what would you like to add to that, if anything? I know Michelle did a great, well-rounded job, but if there's anything that you would like to add.
I mean, Michelle, it's just so brave of you to share your story. And I'm so grateful that paving brought us together. Even if it was breast cancer, I'm so glad that brought us together. So it's been such a gift to work with Michelle through this important work, as she noted. So I will say, when I first met Dr. Beth Frates at a lifestyle medicine conference many years ago through Harvard Medical School, was this conference, and I didn't even know what lifestyle medicine was, except I'm a runner and I'm a vegetarian. So I thought it was an interesting conference to attend. And then I was like, wow, these tools are so important for my patients who I'm seeing every day in clinic, who are asking me, Dr. Comander, what should I be eating? What type of exercise should I do? I have horrific hot flashes. How do I manage it? I can't sleep at night. What do I do? And I'll be honest, in all my many, many years of medical training, I felt like I wasn't fully equipped to answer all of their questions in a very evidence-based approach. And that's where lifestyle medicine really came in and certainly transformed the way I practice. And now we have a great program at our cancer center, and of course the paving program as well. So I will say that these tools are so important to help empower individuals who've had a history of breast cancer to take charge of their health and live their best lives, as Michelle stated so beautifully.
Thank you. So one more question for you before we move on, which is I talked very briefly about AI a little bit ago, but I didn't give you a chance to add anything. So I don't know if there's anything that you would like to add, Amy, on that topic.
Well, I'm glad you gave a shout out to Boston when you mentioned AI research. So I know a number of my colleagues, and I'm thinking of one colleague who I've worked with at MGH, Dr. Connie Lehman, who's done a lot of interesting research and continues to do research and looking at the role of artificial intelligence and, analyzing mammograms and assessing an individual's risk for breast cancer. And that tool may turn out to be better than all the other models that we have out there. And that's super exciting. And that's just one example of a way artificial intelligence can transform the way we diagnose breast cancer and assess risk. So really excited to learn more as this field evolves.
Thank you. Okay, so turning over to the audience, the first question is, how can a patient under 40 diagnosed with stage 1A triple negative breast cancer reduce their risk of recurrence? Not an easy question to start off with, but
I know, such an important question. I'm happy to start off just stating that First of all, I'm sorry that this individual has this diagnosis, but hopefully in very good hands, and glad that she's at this webinar tonight to learn. And certainly for this type of breast cancer, often we do treat these very aggressively with certainly surgery, chemotherapy, maybe radiation therapy, genetic testing, absolutely indicated. So certainly all these standard medical treatments are absolutely key. But I will add that in addition to all these very important medical treatments, attention to lifestyle medicine, how that plays a role is really key. And I think, Michelle, do you want to jump in here just based on what you shared in terms of your own experience incorporating these tools into your own care? Because, Michelle also went through a lot of aggressive treatment.
Yeah. So I'm it's exciting to see the research just continues to come out showing the importance of healthy lifestyle behaviors. So I think that 30 grams of fiber is a great way to start, by making sure that you're getting enough fiber in your diet, a lot of whole foods, a lot of plants, not a lot of ultra processed food, of course, avoiding alcohol. And then being physically active. The American Institute for Cancer Research is probably my favorite organization as far as their review of the literature on nutrition and physical activity. And you can go on their website too, and they have a lot of great information. So lifestyle. I prioritize sleep as never before, after having gone through treatment and then struggling with sleep as well. So I try to get at least 7 hours of sleep in every night. We also know that breast cancer survivors, that it's not just breast cancer that we need to think about. We also need to be thinking about our brain health and our heart health. And so a lot of these healthy lifestyle behaviors that can decrease the risk of recurrence, they also decrease the risk of cardiovascular disease and decrease the risk of dementia, decrease the risk of stroke. And so it's kind of interesting, even though I had expertise in lifestyle medicine, I've been part of lifestyle medicine for years before I had this diagnosis. And I knew when I was diagnosed, I thought like, oh, I need to read the latest information about about breast cancer now, being a breast cancer patient and lifestyle medicine. But it was interesting. As I dug deeper into the literature, I realized that so many of the recommendations for breast health, for breast cancer risk reduction, for breast cancer survivorship are the same recommendations that we give for overall health. They align beautifully with bone health, with brain health, with heart health. Yeah.
Thank you. So I brought up vitamin D earlier, and as most of us, if not all of us, know, there isn't a lot of regulation around supplements, and you can buy them on Amazon and you can buy them at a doctor's office, and you're never quite sure. So do you have a suggestion about how to find the better quality supplements if that is a road that you're going to go down, whether it's a particular resource or what to look for on a label?
That is a great question. And those who know me and Michelle, I know it's the same way. We're skeptical of most supplements, except for vitamin D and maybe a few others. So, but yes, I think for vitamin D, certainly, I think, when I get a supplement such as vitamin D, often I'll go to a place like Whole Foods or another place where I know that the product is researched before just being stuck on the shelf, because it's true. A lot of these things are not well regulated. Sometimes though, vitamin D is given as a prescription. If I see a patient and her vitamin D level is like super low, I will prescribe the vitamin D that's given at a much higher dose, often taken weekly for 8 weeks before they transition to a daily supplement. So that's another approach that sometimes is taken for folks who are truly quite deficient.
Thank you. One thing we also mentioned, but I would love to give just a little bit more color to, is we alluded to dense breast density earlier, and the need for ultrasound or potentially MRI. Can you explain what breast density is? Again, it's one of those guilt factors, but we know, the three of us at least know, it's not about weight or body type. So if you could just maybe address, Amy, what that actually means, and if you do have dense breasts, what you should be asking your doctor to supplement with.
Yeah, so first of all, just thinking about our younger women with breast cancer. I mean, not younger women, put the breast cancer aside, younger women in general. tend to have dense breast tissue. It's just a fact. So it is very common for individuals to read their mammogram report and be like, oh my goodness, I have dense breast tissue. But it's very common. The breasts are made up of fatty tissue and fibroglandular tissue, and that ratio when we're younger tends to be more of the fibroglandular tissue that looks more dense on a mammogram. So it is very common. And I will say, again, it depends on a center where you are, that some centers will recommend augmenting screening with a breast ultrasound. It really does depend on the center. I will say the data is somewhat controversial about the benefit of ultrasound as a screening tool. MRI is used as an adjunct to mammographic screening when the patient meets other criteria, such as I mentioned earlier, strong family history, having a genetic mutation. Through some of the models we use, a greater than 20% lifetime risk of breast cancer. So these are often conversations that really I think an individual does need to have with her doctor to determine, like, what is, again, getting back to this concept of risk assessment and what is the best screening tool in addition to the mammogram.
Thank you. Michelle, there's a question about food. And so I think it's right up your alley if you want to take that one.
I would love to. So I think the question was, what is better, foods or supplements? And I would say, according to the literature, it really looks like we need to prioritize foods in order to help us with decreasing, with breast cancer risk reduction, as well as decreasing risk of recurrence. And so, so when we eat, like, let's say we're eating blueberries or we're eating some type of plant food, we're getting all those phytonutrients or plant nutrients. Maybe people call them phytochemicals or plant chemicals. And so, so often, like, you might have a vitamin that has like a certain, it has this in it, or a supplement that just has these few components. But really, when we eat a food, we have that fiber, we have a variety of phytonutrients. We have different parts of the plant working together in ways that we don't even fully understand. So we like to say, eat the rainbow, because different colored plants have different phytonutrients. Also, like the research around leafy greens, I get excited when I talk about leafy greens for women, especially like through the menopause transition and beyond, regardless of breast cancer survivorship or not. I mean, the research around leafy greens and all that leafy greens can do as far as decreasing the risk of dementia, some brain health things. We just keep learning more and more about the power of plants. So the American Institute for Cancer Research recommends a plant predominant or a plant forward diet, a diet rich in whole grains, vegetables, fruits, and beans, really trying to decrease or limit that consumption of fast foods and other processed foods that are high in fat or starches and sugar. They recommend limiting the consumption of or avoiding consumption of sugar sweetened beverages. They also recommend limiting consumption of red and processed meat, limiting or avoiding red and processed meat. So I would say yes, the eating that way has a much better chance of helping decrease the risk of breast cancer than taking some supplements. In fact, one of their like, I believe it's their top 10 recommendations is actually do not use supplements for cancer prevention.
Thank you so much. Really helpful. So we're coming up on our last questions, but someone wrote in, so much progress has been made with breast cancer diagnosis and survivorship, but there are still disparities around racial and economic lines, like lower survivorship rates among Black women. How do you see this rate improving, and what do you suggest for people that may not have the same access to quality care? So I will, if I could jump in for one second. Part of Breast Cancer Alliance's commitment is to help underserved patients get access to education and to services that they need. So on our website, we do have webinars targeting Hispanic women, Black women, men, at triple negative and a variety of other issues that are free to anybody who wants to access them. And we also do provide grants to some hospitals that then have free mammogram programs so that women who are underserved can get the care that they need. But I think overall, in terms of the disparities and the, improving outcomes, I should say. Any thoughts?
I'm so glad that this question was raised, because I did mean to mention this earlier, and this is a very important issue. And actually, in the United States, where, as this participant noted, we are seeing improving cure rates and better prognosis from breast cancer. If you're an African American woman diagnosed with breast cancer in the United States, your chance of dying from breast cancer is 40% greater than a white woman. 40%. So just let that sink in, and that's horrific, and we all need to work together to address that. I will say that one of the initiatives, really just discussed in the past year, the United States Preventative Services Task Force did lower the mammogram screening age from 45 to 40. Again, that's one organization's recommendation. Before it was 45, now it's 40. And there are many reasons to explain why they did that. It wasn't new data necessarily, but it was really also an effort to ensure we're addressing this healthcare disparity, because unfortunately, African-American women are also more likely to be diagnosed with breast cancer at a younger age. So that's just one example, the examples that Yonni just mentioned. And certainly I know certainly at my cancer center with paving, we did outreach to offer this program at Boston Medical Center for the past 2 summers, which really serves an underserved patient population. So I think many of us in the healthcare field are all working together to see what we can do to address this very concerning disparity in outcome.
I also think, from my experience, that clinical trials are very often targeting white women. There are many fewer clinical trials for Black women, and it's harder to get them to enroll because history has shown that they have been taken advantage of in the past. And so there's skepticism on their part to join, but that is also part of the challenge, because the physiological differences between white women and Black women, just like Ashkenazi women and other women, are in fact factors also in terms of prognosis and diagnosis. So I think that's another area of focus. So the last question I think we have time for is, we know that a lump doesn't always occur with a breast cancer diagnosis, or at least a palpable lump. Are there any other symptoms that people should be on the lookout to help us know to advocate for? Soreness or discomfort in the breast area is the question, which I know is actually usually not an indicator. But are there other symptoms or visual signs that people should be looking for? Also, are the lumps always in the breast? I know sometimes they can be under the arm or the upper chest wall, which people are not necessarily expecting, but Amy, maybe you can address that.
Yeah, so great question. Certainly, I recommend that women do their own exam once a month, just to know what your own body feels like. And as you mentioned, like feeling certainly the breast, the upper chest, and under the arm, that's called the axilla, and that's where our lymph nodes are located. And sometimes the breast cancer first presents with a lump in the axillary area under the arm. So I think that's important. Earlier, we talked about inversion of the nipple. If you see your nipple changing appearance, that's a factor to take into account. And then, thankfully, it's very rare, but there is a diagnosis called inflammatory breast cancer, where the breast gets very inflamed and red, the skin gets red. And that would be something you want to get that checked out too.
Well, I'd like to thank everyone from our Spark Your Health community for being here this evening. And I would especially like to thank Dr. Comander, Dr. Tollefson, and Yonni for being with us this evening. I feel like this talk is something that folks can come back to. There was so much content. I feel like I was in the background taking notes, and there were some really amazing key takeaways. It sounds like there's some really exciting research that's currently being done that's on the horizon. We have AI helping us now. So it seems like a really positive outlook all in all. So I'd like to thank you all for being with us this evening. We did have some questions or comments coming in the chat about the paving the path to wellness. So I'll just remind everyone that I put that link in the chat, and then we'll put that in the post-event communications as well, so everyone will have access to that. And I put details on how to find everybody on this webinar, and we'll send that in the post-email communication as well. So we have many more Spark Your Health events coming up, especially March. It's going to be a busy month, so we hope we will see you back soon. And I'd like to wish everyone a nice evening and stay well.